play. We come together to make sure we learn to be able to give the best to our patients. So on behalf of the Society of Family Physicians of Ghana, it is my great pleasure to invite you to this afternoon CPD, organized in collaboration with pharmacists, on the important topic, lifestyle medicine, the role of NkwaPlus. As primary caregivers, we know that the greatest health challenges facing our communities now, today, is no longer infectious diseases. It includes chronic diseases like hypertension, diabetes, obesity, heart diseases, CKD, and many other long-term conditions. But whilst medication remains essential, we also know that no tablet can replace healthy eating, regular physical activity, adequate sleep, as well as stress management and avoiding harmful substances. That's how lifestyle medicine comes in. It's at no extra cost, and it's also the cornerstone of effective chronic disease management. Today's discussion is also especially timely. Just yesterday, many parts of Accra experienced severe flooding. Beyond the immediate distractions, such events let us know how easily access to care can be disrupted. And patients may be unable to attend our clinics or our appointments and obtain medication refills or seek timely medical advice. So in moments like this, what do? That's how digital innovations like NkwaPlus, as you learned today, will come in and show you how it has the potential to transform care for our dear patients that we see. By leveraging on such digital tools, which Soft Talks have been hammering on this whole year as our theme, digital innovations in primary care, we stay connected to our patients and support them in their management, monitor their chronic conditions, help them have healthy behaviors, and extend quality care beyond the walls of our consulting rooms. Because let's face it, the healthcare team that we have now is not enough to take care of all the patients that we have. So technologies are here to help us. And as primary caregivers, we are here to fully embrace it to make our care for our patients better. So this afternoon, we have seasoned speakers. It's also an excellent opportunity to explore how lifestyle medicine and digital innovation can work together to strengthen chronic care management in Ghana. And I encourage all of us to actively participate. Please remember to put up your questions in the Q&A questions session. That's where we will look at, and then we'll read your questions out at the appropriate time, and you have all your questions duly answered. Please don't use the chat box, as sometimes that can get lost up. So remember to write your questions in the Q&A session, and then we'll read it out and then answer the questions for you. So thank you so much for logging in. Call a friend to call a friend, call a colleague. This is something that we all need to know so that we can talk about and help our patients as we see them. So once again, thank you to pharmacists for collaborating with the Society of Family Physicians of Ghana to bring this important educational session. And also, I wish all of us an engaging, practical, and exciting 2-hour CPD. So to continue, we have the Country Director of Pharmacists Ghana giving us an opening remarks. He's a seasoned man with over a decade experience in clinical practice. He also has been involved in healthcare management, public health, and including senior roles in and outside Ghana. Under his leadership, Pharmacist has advanced quality healthcare, digital analytics, digital innovations, and mobile technologies, including initiatives like NkwaPlus that we'll be hearing about today, Safe Care, Med for All, and Medical Credit Fund. Dr. Entry, as you realize, is a certified executive leader for Massachusetts Institute of Technology and a certified social programs evaluator from the University of Cape Town. Above all, he is also a fellow of the International Federation of Gynecologists and Obstetricians. And this afternoon, he will give us the opening remarks on behalf of PharmAccess Ghana. Dr. Entry, please, your audience.
Thank you, Dr. Damwa, for the kind introduction. Good afternoon, colleagues. My pleasure and gratitude to briefly join you today. I'll take this opportunity to just share a brief on our organization, PharmAccess, that I've been spending the last part of the decade of my life working with. I used to work with Ghana Health Service, but also in Kolebu, and then I joined PharmAccess. It's important because sometimes when we mention PharmAccess, people tend to think that we are a medicines supplier, pharmaceutical company. So PharmAccess was founded in the year 2001 as an international development organization that focused on how to enable Sub-Saharan Africa to have access to HIV medicines. So that's how our name is PharmAccess. We've long departed from that mandate when Global Fund was set up, and eventually all countries started accessing antiretrovirals. But we have kept faith with our name and our brand, and we still use the name PharmAccess. Over the last 5 or so years, we have focused heavily on building the future of healthcare in Africa through the power of digital innovation. So, Dr. Damo, when you mentioned about the theme of the society, it really resonates with our organization. We see ourselves as natural partners. Digital innovation in primary care resonates with us because our mission is also how do we use digital innovations to improve access to care. We go beyond primary care, but it sits within the umbrella of what you are also looking at. So we are 25 years old as an organization, but in Ghana, we have been operating since 2012. So we are about 14 years old in Ghana. And over the last 14 years, we've done work with NHIA as our partner, Ghana Health Service, Health Facility Regulatory Agency, Christian Health Association of Ghana. We work with the professions regulatory agencies and also with the private sector. As Dr. Damwa, you mentioned, just to mention a few of our programs that we work with before we delve into the detailed, interesting discussions about NkwaPlus. We have one of our sister organizations called SafeCare. SafeCare is a quality improvement system. We are operating SafeCare in 27 countries now, involving about 13,000 hospitals, clinics, and working with 40 partners in Africa, India, and Southeast Asia. So interestingly, in Ghana, in the year 2024, at the annual Health Summit, SafeCare was adopted as the national quality system by the Ministry of Health and is currently being implemented by the Christian Health Association of Ghana and Ghana Health Service and some private health facilities. So that's one bucket of the work that we do. The second bracket of the work that we do is around access to loans. And we do that through what we call the Medical Credit Fund. And so far, the Medical Credit Fund operates in 5 countries: Ghana, Nigeria, Tanzania, Uganda, and Kenya. And we've done about 12,000 loans across these 5 countries, worth about 200 million euros. And then the last that I would mention before I mention about NkwaPlus is also what we call the Med for All. So Med for All is if you like, the Amazon for medicines for Ghana. So it's a digital supply chain platform for medicines. Which connects and work with Food and Drugs Authority to connect certified suppliers directly with healthcare providers. And we are currently working with the Christian Health Association of Ghana to implement that. And we're also now bringing on board the private sector. So this is outside of what you hear about NkwaPlus and the digital innovation work that we do. It is like the bouquet of what we deal with as PharmAccess. So next time when you hear PharmAccess, please don't think about medicines. Think about digital innovations to transforming care, both on the supply side, but also on the demand side. But very exciting for me is NkwaPlus. And that's because we are looking at an opportunity to transform episodic visits for patients into, if you like, a continuum of visits where you have patients connecting directly with healthcare providers and focusing on clinical outcomes and not just taking utilization of services, but really looking at whether there's a blood pressure coming down on a weekly or daily basis, and is the blood sugar being controlled on a weekly or daily basis. This is because for two reasons. I'll mention that and I'll end there. The last data that we had from the Ministry of Health, the number one cause of adult death in Ghana is hypertension. And I'm pausing for it to sink in. When we looked at the national health budget of the National Health Insurance Scheme, the single highest cost driver is also hypertension and diabetes. So not only is it costing us money, it's also costing us in terms of mortalities. So irrespective of the amount of money that we are pumping into it, we are not getting the best out of that. So really, we are about to discuss what will put patients at the center of their own healthcare journey to a place where we can get clinical outcomes better than what we have now. The last work done by WHO in Ghana showed that only about 26% of patients who regularly visit their doctors have their blood pressure controlled. 26%. We are not talking about those who don't turn up. We are talking about those who regularly come to us as physicians. Only 26% get their blood pressure controlled. Just with the initial work done with NkwaPlus, we are almost about doubling that amount. So that's really interesting for all of us. So lastly, let me invite you to stay engaged on this CPD. This is not the usual normal CPD where we have two levels of engagement: the technical engagement, where you switch on your device and put the device somewhere and continue with your work. I'm inviting you to add what we call the cognitive engagement. Please add your mind to your device. Listening to what is being said, ask questions, stay curious, post your questions, and I'm sure the excellent team of facilitators can assist to address these questions. So let me end by expressing my gratitude to all of you, Dr. Damwe and the team, the society, but also the excellent NkwaPlus team within Farm Access for this opportunity to interact with you. I thank you for your attention. Please, over to you, Dr. Damwe.
All right. Thank you so much, Dr. Maxwell Entry, for these opening remarks. In fact, you have ignited our thirst for knowledge today, making us understand that truly hypertension and diabetes drives our national costs and morbidity and mortalities in our clinic. And we can attest for it. When you attest to it, when you are in your clinic, about 1 in every 2 to 3 patients that you see will have hypertension presenting to you. So it's a real issue. So it's good that we are having the CPD this afternoon to address how best we can manage this problem. So I move on to our speaker this afternoon. Dr. Meg Jackie Thompson is a family physician and a lifestyle medicine physician with almost 17 years of medical practice. She is committed to advancing preventive health and chronic disease reversal in Ghana. She serves as the non-communicable disease coordinator for Greater Accra region, where she leads strategic planning, capacity building, and implementation of NCD prevention and control programs across districts and health facilities. With extensive clinical and public health experience, Dr. Thompson integrates evidence-based lifestyle intervention into primary care, where she works, and empower individuals and community to prevent, manage, and reverse conditions such as diabetes, hypertension, obesity, and cardiovascular diseases. Sometimes we don't think that our patients can have their conditions reversed, especially when we're able to diagnose it early enough. And today she will share some light on that for us. She's also the founder of Current Medical Consults, Lifestyle Medicine and Aesthetics, where she champions patient-centered wellness, weight management, healthy aging, and holistic care. Dr. Thompson, after the CPD, I'll be seeing you for my weight management. Her work emphasizes the power of nutrition, physical activity, sleep, stress management, and social support as core pillars of the health. Ladies and gentlemen, help me welcome my good friend and colleague, Dr. Jackie Thompson, as she takes us through lifestyle medicine, its role and its use in chronic diseases. Dr. Thompson, over.
Hello and good afternoon. Thank you for the introduction. Baba, I'll be waiting for you to come and see me. So this afternoon, we are looking at the role of NkwaPlus in lifestyle medicine. And my objective this afternoon is be to explain how the digital health supports lifestyle medicine. So review the evidence for digital health and chronic disease management. And then we will also describe how the NkwaPlus features help with lifestyle medicine, and then also identify key opportunities for integrating the NkwaPlus into clinical practice. So as was mentioned earlier, we know and are aware that non-communicable diseases are a major cause of death globally, and we see that 74% of all deaths are attributed to these non-communicable diseases. Cardiovascular diseases being at the very top of this. So we see that worldwide, about 1.3 billion people are affected by hypertension, and these numbers are growing on a daily basis. Diabetes has also been found to affect 537 million people. In Ghana, the picture is not any difference. The prevalence of hypertension is about 30% and is also growing. The diabetes burden is not getting any smaller, it's also growing. As at 2023, the burden was about 5.2% and it's increasing. The problem is not just about the growing burden of the NCDs, but also because there's poor adherence to treatments and lifestyle. There's a problem because patients are not able to spend enough time with their primary healthcare providers. Because of this reduced amount of contact time, it's important that we find other innovative measures to be able to counter this challenge that we face. So why does digital health matter in lifestyle medicine? You see that lifestyle medicine is based on behavior change. That's the main thing that drives the change that we want to see in our patients. And like I mentioned earlier on, patients spend just a few minutes with their clinicians, and it's not just on a daily basis, but it's for a long period of time. Most of the time, we schedule our patients to come and see us monthly or every 2 months or every 3 months, depending on how well the patient is being managed. The thing about lifestyle medicine is that we need to sustain the change by reinforcing daily. And this is not easily achievable when we don't see our patients very frequently. So the lifestyle prescriptions that we give them to adhere to becomes a bit of a problem, because the zeal with which they begin with at the beginning gradually declines over time. So when we have a means of reaching them on a more frequent basis, then we are able to reinforce this lifestyle prescription and help the patients to achieve the goals that they want to be able to achieve. The other problem is that sometimes a patient is deteriorating and you don't get to find out until it's too late, because the patient will come and see the healthcare provider after several weeks. So when you are able to have another way of reaching the patient more frequently, this is curtailed. So why does digital health matter at all? It provides a bridge that will cause continuous care to be achieved, because you don't have to wait for the patient to come in person to be seen. The patient can interact with the provider and then vice versa, and then any issues that pop up will be dealt with before the patient comes in to see the person. With NkwaPlus also, you are able to monitor the patient. The patient is also able to monitor their numbers, be it their blood glucose or their blood pressure. And then the healthcare provider is also able to provide coaching. And it's not just on the part of the prescriber, but the nurses are also able to use this means to reach their patients, to be able to provide coaching as well as education. And then any intervention is given remotely. So according to WHO, adherence to long-term therapy for most of the chronic diseases that we see is about 50% in developed countries. The story is not any different for developing countries. The adherence ranges from about 25% to about 40%. So it's important that we address this adherence problem if we want to be able to deal with this growing burden of HCPs. So sustaining healthy lifestyle behaviors remains a big challenge for many of our patients, and we are trying to find a means to help them to be able to solve this issue. Like yesterday, because of what happened with the floods and traffic and not being able to commute from one place to the other, if we have digital health tools, we'll be able to reach out to our patients to be able to solve their problems without them necessarily coming to us. When we have these digital health tools as well, the patients are accountable. So then they find the need to be able to adhere to what they've been asked to follow. And this helps for them to achieve the long-term behavior change that is required to resolve these lifestyle-related conditions. With the digital platforms that we have, and we are talking about NkwaPlus, is an example of a remote monitoring or a mobile health tool that will send daily or weekly reminders to the patients. It helps the patient to be able to track their goals. When they come and see us, we give them an action plan to follow. So when we send them daily reminders, they are able to tick off what they are able to achieve on a daily basis. It also helps them to monitor their numbers because they check their BPs or their blood glucose or their weight on a more frequent basis. And this helps them to be able to keep track and see the trend so that they're able to make adjustments or be able to communicate what their challenges are. And then they also are able to get good feedback from their provider. And then the NkwaPlus also helps for the doctor or the prescriber who is in charge of a client give real-time support, because when alerts come in, the provider is able to see and then provides the necessary help or the necessary feedback that the patient requires. So with lifestyle medicine, we have the various pillars that we usually look at, and NkwaPlus has a capability of addressing all of these pillars. So when it comes to nutrition, we have reminders to remind the patient about the kind of diet that they are supposed to follow. With physical activity, it tracks their activity, it asks them how much exercise they've been able to do, how long they've exercised for, what kind of exercise that the patient has been engaging in. When it comes to sleep, it helps to give sleep education and also provides the ability to monitor the quality and then as well as the quantity of sleep that the patient has had. It also gives management for stress by sending messages for the patient to be able to relate to and then follow. And then it also sends behavior change messages as well for risk avoidance of risky substances like cigarette smoking and then alcohol as well. And then ongoing provider engagement is also provided on this platform. But when it comes to hypertension management, there have been quite a number of publications, systematic reviews, and meta-analysis done over the past few years. And a quite recent one was done about 2 years ago, where 28 studies underwent systematic review and meta-analysis. And it found out that digital health interventions were associated with a significantly higher reduction in systolic blood pressure when it was compared to the traditional care that we usually give to patients in our clinics. Another review also found out that remote patient monitoring also helps with hypertension control, as well as patients being able to give themselves self-management through self-monitoring and then self-care. So why do patients benefit from digital health tools like NkwaPlus? They're able to monitor their blood pressure, blood glucose more frequently. They're able to see the trends, and they are able to adjust medication as they are being advised by their healthcare provider. And it also helps them to be able to monitor their lifestyle changes and then also improve their lifestyle changes, because they are getting constant reminders and messages on a very frequent basis. And this also provides a source of motivation, external motivation, for them to be able to continue what they have been advised to follow. There are many advantages of having a digital health tool, and the advantages or benefits are not just to the patient alone, but to the provider as well, to the hospital, and as well as the healthcare system. When it comes to the clinician is able to monitor the patient remotely so that complications do not set in before an intervention is put in place. So through the NkwaPlus, the prescriber is able to see whether the patient's blood pressure is elevated or whether the blood pressure is normal or whether the blood pressure is dropping or not, and it's able to advise accordingly. It also helps the patients to adhere to their medication because they're giving them constant encouragement to be able to do so. And the patients feel that they are getting more attention from their healthcare provider, and they are better engaged so that they can continue with their self-care as well as self-management. Another study done by Dennis et al. In 2025 showed that stage 2 hypertension was reduced in about over 8,000 patients that were followed over a 12-month period, in that the systolic blood pressure was reduced and the stage 2 hypertension was reduced from as high as 100% to 25%. The advantage of NkwaPlus is that it combines all these that I've mentioned: home monitoring, patient engagement, lifestyle coaching, clinical oversight, to be able to monitor the patient very well. When it comes to diabetes, the story is not any different. A lot of research and a lot of studies have been done to show that HbA1c levels have been reduced because patients have been able to monitor their glucose more closely, and they've been able to get advice, they've been able to get messages not only from what they've been told in person, but the constant messages that they get on a daily basis in order to be able to manage their condition better. And it also encourages them to adhere to their medication. And patients have testified that they have higher satisfaction because they are engaged more. Why does this work? It works because the patients have better control of their condition and they are active participants rather than passive recipients of care, because you've been able to give them that tool to be able to track their progress and then also receive constant feedback. NkwaPlus, what does it do? It helps us to be able to monitor our patients daily or weekly, or as often as we think that the patient needs to be seen. This, as compared to traditional care, is much better because patients are able to adhere much better. So, like I mentioned earlier, the digital health tools help the patients in various ways, helps the clinician also in various ways, and also helps the healthcare system as well. On the part of the patient, it helps to reduce hospital admissions and readmissions. It decreases their visits to the emergency room, and on the whole, gives them a better quality of life. And that is because the healthcare provider is able to notice any complication and then intervene early and not just wait till it's too late. For lifestyle medicine also, maintenance of motivation is very key to attaining or achieving the goals that have been set for the patients. And it's not just about self-motivation. Earlier on, I mentioned that the motivation must be both internal and external. So in using the digital health tool, the patient's initial self-motivation is maintained at a high level because the practitioner or the healthcare provider comes in on a daily basis, and then also the app enables the patient to see these messages more frequently than they would usually have them if it was just traditional care that was being given. The patients also use their monitoring devices, and it encourages them to monitor themselves more frequently. So it's been found out also that patients who regularly monitor their health are likely to achieve their lifestyle goals because they adhere to the treatment or the management that they've been asked to do. And then when they see the trends, they see that there's improvement, and then motivation is maintained at a high level. So what are the benefits to clinicians? We are able to see our patients' numbers, and then we are able to monitor them more closely and efficiently. Then we are able to also prioritize high-risk patients, because when you have a number of patients key in their results as frequently as they need to, you're able to, the app is able to tell you that there are patients who need to be seen immediately because you have various degrees of alerts, and it prioritizes those who need to be seen immediately over those who can wait a little longer to be seen. And then also it helps with better clinical decision making. So what does it do for the health systems? It helps us have reduce unnecessary visits. Most of the time we come and then we see that there are quite a number of patients sitting in line at the OPD to be seen. If the patient is being monitored remotely through an app, then the patient doesn't necessarily have to travel all the way to the hospital just to come and find out whether the medication dose that they've been prescribed with is what they are taking or not. They can communicate with their healthcare provider using this app, and then that will reduce the burden on the facilities in the hospitals or the clinics. And then it also helps to better utilize resources, because in that way, one healthcare provider is able to see many more clients than they would rather see in person. Also, there's better access because patients who are far away, like in the rural areas, can receive follow-up care. And then travel costs are reduced because usually there's a financial burden. If there's a patient who usually maybe have been screened in the community and referred to go and see a doctor, most of the time they would complain that they don't have money for transportation. But if this digital health tool is available and they can use it efficiently, then that burden is taken off them. Then what else do we achieve from this? We have better outcomes. The disease is better controlled, and then we have reduced complications, and in the long run, mortality is decreased. So for NkwaPlus, what does it do? Not only for lifestyle medicine, but for other aspects of clinical medicine. It encourages continuous engagement, and then it gives very good behavior change support, which is necessary, and it is very vital for managing non-communicable diseases. Accountability, which is key in managing these long-term chronic conditions, is also available because the patient knows that when they key in their figures, the doctor is available or the healthcare provider is available to review these numbers and then give them feedback. Like I mentioned earlier on too, the monitoring is not just on the part of the patient, but also on the part of the healthcare provider, in that you are seeing live feeds from the patient, and then you are able to adjust medication and management better. NkwaPlus also provides a platform for education because it gives constant messages on what patients to do to manage themselves better when it comes to hypertension, as well as diabetes and obesity and the other chronic conditions that they are dealing with. It also provides a platform for long-term follow-up so that the patient is able to give you their numbers over a longer period of time. And all of these can be found on just one platform. So then it becomes a virtual extension of the diabetes or hypertension or chronic care clinics that we usually run. So what applications do we have, or what applications can we have NkwaPlus in? For our clinics, like I said a few moments ago, that our diabetes clinics, hypertension clinics, we can use NkwaPlus because we're able to monitor blood glucose, monitor blood pressure. We can have dietary coaching, weight monitoring, etc. We can educate them on their physical activity, sleep and stress, etc. And then we in turn have better results or better outcomes for our patients. For lifestyle medicine clinics, it's the same. We can track their physical activity and then give habit formation support, as well as monitor weight loss. And then community-based NCD programs can also use this digital health to do follow-up after screening exercises. Most of the time when we do screening, some of the patients end up not being seen in the bigger facilities. But with this app, a patient is or a potential client has this app and is able to use it, and then the community health worker is able to track them more easily. So what do we take home from this? That NkwaPlus, which is a digital health innovation, helps us to get our patients to have improved blood pressure control. It also helps to improve the outcome of diabetes, in that the patients are able to monitor and then adjust their management with the advice that is being given to them from the healthcare provider. And then patient engagement is increased. It also improves adherence to medication and to treatment. And then it helps to detect duration so that early intervention can be put in. Hospitalization is decreased, and then overall efficiency is also increased. So NkwaPlus can help all physicians move from seeing patients every 3 months to support our patients every day. And this causes a shift from the episodic care to continuous care. Thank you very much. And if there are any questions, we will take them afterwards.
All right, thank you so much, Dr. Thompson, for your presentation. We are very enlightened about how NkwaPlus comes in the management of our patients with chronic diseases, and also the overview of lifestyle medicine. We truly appreciate you. Like I said at the beginning, please feel free to post questions in the Q&A. Anything you don't understand, anything you need clarification on, if you have any comments, any success stories, you can also put it up so that we read it during the Q&A session. She's spoken a lot about NkwaPlus, and I'm sure we are all wondering what it is. So I will invite Dr. Entry to we have a video, to do a video demonstration of NkwaPlus, and afterwards I will introduce the next speaker. So stick on, don't go anywhere. There's still more to give, and then afterwards we will go into the question and answer session. Thank you.
Across Ghana, a silent emergency is unfolding. Millions of people are living with hypertension and diabetes, conditions that are manageable, yet remain largely undiagnosed, untreated, and dangerously uncontrolled. The consequences are devastating: strokes, kidney failure, heart disease, lives cut short, families shattered, a health system under siege. Today, patients see their doctor once every few months for a few minutes. In between, they are on their own. Medication adherence slips, complications silently advance, warning signs go unnoticed. We need a smarter system, one that reaches patients where they are and keeps them connected to care, in between hospital visits every single day. Introducing NkwaPlus, a digital health application purpose-built to transform how hypertension and diabetes is managed. NkwaPlus moves care beyond the walls of the clinic. It creates a continuous, connected relationship between patients and their doctors through a simple, powerful mobile application. Clinical and lifestyle schedules, monitoring and guidance, all integrated into one seamless app for every patient wherever they are. NkwaPlus enables sharing of vital signs from home directly with doctors instantly. When a vital falls out of range, the system alerts doctors in real time. Doctors can consult with you immediately via video conference. Early intervention. Before crisis develops, patients receive personalized reminders, lifestyle guidance, and progress updates, keeping them informed, motivated, and firmly on track. NkwaPlus supports patients and clinicians to achieve outcomes that matter. Stronger medication adherence, earlier identification of complications, reduced hospitalizations and emergency visits. For health systems and insurers, NkwaPlus has the potential to connect more patients, helping reduce the cost of poorly controlled chronic diseases in healthcare. For patients, it means something more fundamental: the confidence of knowing they are never alone in managing their health. NkwaPlus is shifting care from episodic to continuous care, from reactive treatment to proactive management. To the doctor keen on efficient management and control of patients' conditions, and to the patient seeking better results, get in touch and let's reimagine your care journey together. NkwaPlus, care on the go.
All right, thank you so much. Now you have an overview as to what NkwaPlus is and how it fits into the model of care for managing chronic diseases in Ghana. Don't look at it as something that is far-fetched or is beyond that. It's something that you have a smartphone and everybody now have a mobile phone. And with this app on it, we can be able to see our patients in real time. Like Dr. Thompson said, it promotes better efficiency and also allow us to have access to our patients instead of the 2 monthly or the 3 monthly time that we have. So next, we want to introduce the next speaker. He is Dr. Kwesi Owusu-Antwi and is currently the project manager of Farm Access, where he leads implementation of value-based care initiative for non-communicable diseases in partnership with the National Health Insurance Authority, the Christian Health Association of Ghana, and other key stakeholders. His work focuses on designing and scaling innovative digital health and health financing models, including AI-enabled remote care, reimbursement mechanisms, and outcome-based payment systems that strengthens chronic care disease management. A pharmacist by training, Dr. Antwi holds a master's in public health from the University of Ghana and executive MBA in marketing from the University of Ghana. So, ladies and gentlemen, let's welcome Dr. Kwesi Antwi to take us through the role of NkwaPlus in the management of hypertension and diabetes, the 2 leading causes of our NCDs in our clinics. So kindly let's listen to him. And like I said initially, remember to post your questions in the Q&A session, so when we get there, we can be able to address them for you. Dr. Antwi, over.
Thank you very much, Dr. Damwa. If you can confirm if you can see me and also see my screen.
Yes, please.
Okay, thank you very much. So my job today is to talk to you about NkwaPlus, a digital remote monitoring application that helps in the management of patients with hypertension and diabetes. We've already shown you a video just to give you a background of what NkwaPlus does and how it solves some of the problems you are currently dealing with within NCD care, chronic care. So this is going to flow my presentation. I'm going to talk a little bit about Farm Access, and I'm also going to tell a story about how we got here in the first place, a non-profit organization trying to roll out a digital remote monitoring application to help deal with the issue of hypertension and diabetes. I'll speak about that. Then I'll also speak about NkwaPlus as a platform, the benefits that it offers clinicians and also patients. And I'll also give you an insight into what the future looks for in NkwaPlus. So these are the main things that I'll deal with in my presentation. My country director has spoken about this already, but I'll still say a little bit about Farm Access. Farm Access is a non-profit organization that is super passionate about leveraging data and connectivity to transform healthcare, of course, with partners. Our approach has always been working with public sector and private sector, drawing on capacity and investment to drive innovations that deliver quality and affordable care to everyone. And you may have come across some of our projects. There's Safe Care. Safe Care is a program that has been adopted by the Ministry of Health as the official quality improvement model for facilities in Ghana Health Service, and also CHAC facilities, and even some private institutions as well. We also have a program called Medical Credit Fund that provides healthcare institutions with funds to be able to scale their healthcare businesses. The other program is also Med4, which is more or less a digital procurement platform that connects suppliers with facilities such that they're able to get access to quality medicines at an affordable price. But more recently, we've been having conversations with the National Health Insurance Authority about designing outcome-based payment models for NCDs, particularly hypertension and diabetes. The reason being that, the healthcare financing system largely in Ghana is volume-oriented. So the more patients you see, the more you are rewarded or reimbursed by the National Health Insurance Authority. But the challenge is that even though we are seeing more and more patients at our clinics, we get to realize that most of these patients actually turn up uncontrolled and end up with complications. What that means is that when they end up with complications, then the National Health Insurance Authority has to again, fund the management of these complications with resources that could easily be diverted into other areas or other disease areas of focus. Our view is that working with the National Health Insurance Authority to design tariffs based on outcome-based models, we should be able to shift the focus from a volume-oriented health financing system to a more outcome-based oriented health financing system. And in doing that, we should be able to reduce the rate of complications in patients with hypertension and diabetes. We believe that the future of chronic care should be more about less complications and less consultations and less about fewer complications. The other conversation that we are having with the National Health Insurance Authority is to introduce digital remote monitoring, tariffs for digital remote monitoring. The reason is simple. The reason being that as healthcare workers, we are all aware of the critical role that continuous monitoring plays in the management of hypertension and diabetes. And we are aware of that. It's the reason why we ask our patients to note down their readings on pieces of papers and present them during our clinics when they are due. But then what happens when there's a spike in BP in between these visits? What happens when the glucose reading falls below the normal threshold in between these visits? We are never aware of, these happenings in between visits. We think that if technology is leveraged enough that we are able to have near visibility or near-time visibility on patients in between visits, we should be able to support these patients better. And we should actually have better, data to be able to support these patients for the next visit us at our clinic. That is the whole concept of digital remote monitoring. Currently, technology in the space of chronic care has largely been focused on telehealth or telemedicine, which is great. We are all excited about telemedicine, but we will all agree that, telemedicine does a lot in improving access to care and also in, improving convenience around visits and all. But it hardly moves the needle when it comes to the ability of patients to meet their outcomes. As an organization, we are of the view that telemedicine should always go hand in hand with digital remote monitoring so that the patient has a comprehensive package that addresses not just the convenience of visits around their management, but also has a model that helps him or her to be continuously monitored whilst away from the institution. And it's the reason why we are working with the Insurance Authority to introduce tariffs for digital remote monitoring so that facilities are encouraged to adopt this care model as a means of managing patients with hypertension and diabetes. Our conviction in digital remote monitoring also stems from the fact that we've actually tested this model over the years with a number of prominent hospitals. And we started this testing process just around the period when COVID struck. When COVID struck in 2020, we worked with the University of Ghana Medical Center to roll out an application called COVID Connect. COVID Connect was an application that supported the University of Ghana Medical Center to remotely support patients with COVID-19. So basically, you have a remote monitoring application where COVID-19 patients are able to share their symptoms and also reach out to doctors when they needed their support. At the back end, doctors at the University of Ghana Medical Center were also able to reach out to patients when they felt that the vitals that they were seeing or when they felt that the data that they were seeing from patients were such that they needed to step in to support these patients. We implemented COVID Connect with University of Ghana Medical Center for some time, but when COVID died down, we realized that the patients were still sharing their measurements. And by the way, we onboarded close to 4,000 patients on this particular platform. So the conversations were, how do we reapply the care model we are designed for COVID patients in other disease areas to drive impact? Given that the fact that, I mean, at the time, and even still now, we're having to grapple with some of the challenges with NCDs, we decided to refocus the care model on patients with hypertension and diabetes. So COVID Connect evolved into another application called the Lucy application. And since we focused our efforts on patients with hypertension and diabetes, we've had to implement this Lucy application in close to 2,000 patients. We've onboarded 11 hospitals, onboarded about 2,000 patients. We've tested, the care model, digital remote monitoring care model in these patients. And we've learned a whole lot of, lessons and come across several challenges. Because it turns out that implementing digital remote monitoring, especially within our setup and in patients with hypertension and diabetes, is actually very, very, very difficult. And it's not surprising because of the kind of system that we run here in Ghana and also in other lower middle income countries. So even though we came across these challenges, our focus really was to find out if digital remote monitoring worked as a care model. And we did that by commissioning a research project 3 years after we had started implementing the projects, just to find out if the monitoring care model was actually working. And we came across some very interesting results. We found out that, amongst other things, 50% of patients that were put on digital remote monitoring as a care intervention were controlled in a matter of 5 weeks. So that actually spurred us on to think about how we could scale digital remote monitoring for more patients with hypertension and diabetes to benefit from that. So we worked with the designers of COVID Connect and also Lucy to identify a local partner that could help us develop an application that was well suited for the setting we find ourselves here in Ghana. And that's how we ended up with NkwaPlus. So NkwaPlus is an all-in-one platform designed with functionalities focused on not just telemedicine, but also digital remote monitoring and also lifestyle scoring. And this is how the model works. Typically at a clinic, you have a doctor identifying a patient that he feels might benefit from the NkwaPlus care model. So it could be in a hypertension clinic or it could be in a diabetes clinic. When that patient has been identified, the patient is then referred to a back office team, which is usually made up of a team of nurses. And the back office team will be responsible for helping the patient download the application on their mobile phone, training the patient on the correct way of measuring their vitals, and also training the patient on how they can appropriately share these vitals on the NkwaPlus application. At the back end, the back office team are able to also onboard these patients and capture the baseline readings of these patients, i.e. their body mass index at the time of onboarding, so that the team can actually track progress on some of these vitals as the patient goes through the care model. When the patient has been onboarded, the patient is assigned to a particular protocol. So if the patient is a patient suffering from severe hypertension, very likely the patient will be sharing their measurements more than twice a week. If the patient is suffering from hypertension that is not too severe, they may be sharing their measurements on a weekly basis. What happens when the patient shares their measurements during this period of time is that the patient immediately gets an alert from NkwaPlus that alerts the patient on whether his or her blood pressure is high, normal, or low. If, depending on what alert the patient gets from NkwaPlus, it serves as the first level of support system for the patient to readjust their lifestyle so that they're able to meet their clinical goals. Now, at the back end, while this patient shares his or her measurements, clinicians are able to see these measurements captured in a color-coded system. So for very, very, very high measurements, you have at the back end, the measurements being color-coded as red alerts. for not so severe measurements. You would have these measurements being color-coded as an amber alert. And for normal alerts, you would have these alerts being color-coded as a green alert. So red alerts are programmed in a system such that clinicians are to process or attend to these alerts 24 hours after they've been shared, for obvious reasons, given the fact that these are very high BP readings and may require some kind of interaction with the patient. Then for amber alerts, these are alerts between red and green alerts. It has been programmed in a system such that the clinician may have to process these alerts 72 hours or 48 hours after the alerts have been shared. For green alerts, because they are normal alerts, it has been programmed in the system such that the NkwaPlus application automatically processes it, and the clinician is not required to follow up on the patient for these alerts to be processed. In the case where these alerts are very high, NkwaPlus provides you with an opportunity to reach out to the patient via SMS, via video conferencing, so that if there's any clarification needed or if there's any advice that is needed from the hospital team, that can be done immediately. So this is how the care model actually works. And as simple as it is, when we started the implementation of digital remote monitoring, we realized that this model was actually a very, very difficult model to implement in hospitals. So we thought to ourselves how we could simplify this so that, it was much more efficient to implement in some of the facilities that we were working with. At the time, we had a model where patients had a mobile phone with the application downloaded on. Then we had one platform where clinicians could actually see the measurements and process these alerts. But with the lessons learned, especially having to do with the fact that digital remote monitoring was very, very difficult to implement in facilities without the support of management and without giving visibility to supervisors within NCD care teams, we decided to change this approach. So we changed the approach by ensuring that NkwaPlus is developed in such a way that we have a bouquet of 4 platforms. So you have a mobile application that the patient is able to share measurements with, and you have 3 other platforms that serve the purposes of supporting 3 different types of members within a typical care team that is set up for the digital remote monitoring in the facility. So first platform is a clinical care coordinator platform, which is a web interface. So the clinical care coordinator web interface or clinical care coordinator platform basically is a platform that would be used typically by your medical director or the head of the clinical care team within a hospital in charge of NCDs. This platform will provide the clinical care coordinator with information on the number of red alerts coming in, the number of amber alerts coming in, the number of green alerts coming in. It also would give visibility to the clinical care coordinator, the speed at which these alerts are being processed by his or her team. And it will also give the opportunity to the clinical coordinator to be able to also tell the percentage of patients controlled on the digital remote monitoring application. Finally, it even gives the opportunity for the clinical care coordinator to assign specific patients to specific clinicians based on that peculiarity. So that's the clinical care coordinator platform. Then you have, of course, the care team platform that serves as the platform that enables exchange between the frontline team of clinical workers with the patient. So this particular platform would basically provide the care team member with the number of red alerts coming in, the number of amber alerts coming in, and also provide the care team member the opportunity to process these alerts. The last platform, which is the facility administrator platform, is one that was built out of lessons drawn from implementing digital remote monitoring. Whilst we were implementing the monitoring program under our project, we kept getting feedback around the fact that as much as the care model was effective and all, facilities were finding it very, very, very difficult to actually build, businesses around the care model. So we decided to design a platform that supports the facility administrator to closely monitor payments coming in, patients due for payments, number of patients onboarded, and even manage the billing around, for instance, patients that are being sponsored by health insurance companies. So that is exactly what this administrator does. This administrator platform does. It's a platform that provides the facility administrator to be able to manage the business around NkwaPlus at a care model. On the mobile application, I've already spoken about this, but the mobile application provides the patient the opportunity to share their measurements, their blood pressure measurements, and other measurements as well. But the other thing that we've added, and which we learned whilst implementing digital remote monitoring, was also to add a functionality which allowed patients to share measurements related to their lifestyle behavior. So it could be a question asking you how many units of alcohol you've consumed in the past 7 days. The reason being that, we are told that 60 to 70%, 50 to 60% of what we see in hypertension and diabetes are actually as a result of our behavior. So we felt that if we're going to develop a remote monitoring application to help patients and to help clinicians track the vitals of patients, we could only do that by not only providing an opportunity for patients to share their clinical measurements, but also share their lifestyle measurements as well, so that at the back end, clinicians have the total picture of the patient's fairness, clinical measurements, and also lifestyle measurements. So when these lifestyle measurements are shared at the back end, the clinician is able to see these measurements in a quantitative manner, in the form of a lifestyle score. And the clinician is actually able to make inference as to how the patient is doing by comparing this lifestyle score with some of the other measurements that have come in. Other functionalities that are built into NkwaPlus are: one, side a lifestyle tracker, which I've already spoken about. It also comes with educational content, educational materials on, what diabetes is, and other content that should be of support to patients that are onboarded onto the NkwaPlus platform. There's also data analytics inbuilt within the platform, such that clinicians and also hospital managers are able to get a good read on how patients are faring. If there's an opportunity or if there's an interest in conducting research with some of these data, we've actually provided a meta-based access that provides more detailed data in an anonymized format for these hospitals to use, or hospital managers to use. Mind you that each and every patient that is onboarded onto the NkwaPlus platform is taken through a consent process. So in instances where hospital managers want to use data of patients to conduct these research projects, they would always have to go through the right procedure for this data to be used. We've also built into NkwaPlus billing systems and also payment systems that allows patients to easily pay for the service. So patients can typically pay for the NkwaPlus service using Momo, Airtel, Tigo, or even Telecel Cash. And also for patients that are being sponsored by insurance companies, or patients that are being funded by insurance companies, billings can actually be done on the NkwaPlus platform by administrators of facilities onboarded on the NkwaPlus platform. So the solution is such that clinicians can be onboarded onto the platform in two main ways. You can be onboarded as a facility onto NkwaPlus, or you can be onboarded as an independent account. That is, if you are a private medical doctor who wants to manage a group of patients by yourself, independent of a facility, we offer you the opportunity to also be onboarded on the platform as such. So you are onboarded either as an institution, or as an institutional account, or as an individual or independent account. And you design a whole business model around the administration of NkwaPlus. Also, bearing in mind that we are a non-profit organization, and really the higher goal is for us to ensure that this particular application is used by as many patients as possible to improve their conditions of hypertension and diabetes. The business model is such that you don't, as a facility or as an independent account, you don't make any upfront payments to us. We've heavily subsidized the platform such that we've built into the model the opportunity for facilities and individual accounts to set up their own fees. So when you're signed up on NkwaPlus, you can set up your own fees. And the arrangement is that we split revenues with you at the end of the month, 80-20%. So 80% going to the institutional account or the independent accounts, and 20% coming to Farm Access and the developers of NkwaPlus. So that's the business model that we've put in place. For self-paying patients that are paying out of pocket, what that will mean is that at the end of the month, when the revenues have been collected, we'll split it 80-20, and 80% will automatically go to the facility or the independent account through any form of payment platform that is agreed between parties. But for patients that are being sponsored by insurance companies, we would actually allow facilities to collect these payments from insurance companies and pay our 20% to us 90 days after the month has ended. We actually factored this into the business model, bearing in mind that most of the insurance companies that we normally work with in Ghana sometimes take some time before they actually make payments to facilities. So for the self-paying patients, we split the revenues and we share with facilities 80-20%. But for corporate clients, we allow some time for the facilities to collect payments from the insurance companies, and then after 90 days, make payments to Farm Access. That is a 20% payment. What are the opportunities of integration for NkwaPlus within healthcare institutions? We've had conversations with facilities on how potentially NkwaPlus could be integrated into clinical workflows within facilities. And some very, very interesting ideas have actually come up. Some we've actually seen implemented in these facilities. For some facilities, they prefer that NkwaPlus is targeted at, chronically uncontrolled patients who are not getting any better on their medications, so that they can be closely monitored and the right interventions implemented. Other facilities have preferred to, target newly diagnosed patients with NkwaPlus, so that it serves as some form of early disease management care model. The other facilities that also prefer to use it as a post-acute care model for patients that usually will be discharged, but with some form of complications. Some facilities have also recommended using NkwaPlus for their post-op and pre-op procedural care. There are a few facilities that have also proposed that they could actually use NkwaPlus in monitoring patients, especially when therapies of patients are adjusted whilst they go through their treatment. A few facilities that have patients located in the diaspora have also suggested leveraging NkwaPlus because of its dual functionality of providing telemedicine and also digital remote monitoring services. So these are all options that can be leveraged by institutions that are interested in NkwaPlus as a digital health solution. Much as we are excited about NkwaPlus and the opportunities it presents to patients and also to clinicians, we are also even more excited about the opportunities that lie ahead. I've already spoken about the conversations we are having with the National Health Insurance Authority in introducing tariffs for digital remote monitoring. We are having these conversations because we want to see the move. We want to see how best we can encourage facilities to adopt this care model so that we are able to deal with some of the challenges we are having with NCDs, particularly hypertension and diabetes. We are also thinking about artificial intelligence being incorporated into NkwaPlus. If you have all the data on clinical measurements and if you have all the data on lifestyle behaviors, we believe slapping artificial intelligence on that data should be able to generate actionable insights that support patients better to change their lifestyles and even support clinicians better in their clinical decision making. The last thing that we are also having as an organization, conversations that we are currently having is around the area of health wellness and interoperability. We envision a future where just like Momo wallets, our clinical health, our health records should be able to we should be able to carry our health records in clouds from one facility to the other. So, for instance, if I access or if I visit Kolebu Hospital and I'm treated for hypertension, and I find myself in Kumasi and end up at NkwaPlus Teaching Hospital with something that needs to be addressed by clinicians, I shouldn't repeat all tests before I'm seen by patients. I'm seen by clinicians at NkwaPlus Teaching Hospital. I should be able to just draw on whatever data we find in this wallet to support the clinicians to be able to treat my ailment. So these are all conversations that we are having as an organization, and coming on board with us with NkwaPlus would also mean that you'd also support us, or you'd also have a seat beside us in tinkering about some of these solutions and potentially coming with ideas as to how to deal with them. My last slide. So the key takeaways from this presentation: one is the fact that NkwaPlus is not a new platform. NkwaPlus is it's not a new platform. It's a care model that has been in the system for some time now. We've developed NkwaPlus from having to test digital remote monitoring for over 3 years and across 11 hospitals. So it's a care model that has been built drawing lessons from implementing digital remote monitoring for some time now. Secondly, NkwaPlus does not only provide you with telemedicine functionality, but it also provides you with the opportunity to digitally monitor your patients. In fact, we are more excited about the remote monitoring capabilities of NkwaPlus than the telemedicine functionality because of some of the reasons that I've shared with you previously. NkwaPlus also provides you with the opportunity to also monitor the lifestyle behaviors of your patients. We are told that 50% of our what we see in hypertension and diabetes is as a result of our lifestyle behavior. So NkwaPlus coming in with a digitized behavioral change model helps us to address this particular gap when it comes to the management of patients with hypertension and diabetes. In the business model of NkwaPlus, we do not ask for any upfront payment. We simply ask the facility to set their own fees. Then at the end of the month, we split revenues collected from patients 80-20 with the facility. Finally, with NkwaPlus, you also have the opportunity to work with us in designing a financing model that helps address the rising rate of complications within patients with hypertension and diabetes. Thank you very much.
All right, thank you so much, Dr. Kwesi Entry, for taking us through what NkwaPlus does for our patients and then our health team and the facility or institution as a whole. You've made us understand that this digital tool innovation is not only beneficial to the patient that we see, but as doctors, pharmacists, dietitians, nurses, and we see these people, it's also beneficial to us, and it helps our health system where we are working and the various levels of care that we give our patients in this country. So we are truly grateful for this presentation. If you don't mind, you can, I want us to play the video again to help aid understanding whilst I collate the questions, the many questions that we have on our Q&A and chat box, so that we can get to that immediately the video finishes playing. Okay, can we have the video of NkwaPlus? Yeah, you have to share so that we can share. Yes.
Across Ghana, a silent emergency is unfolding. Millions of people are living with hypertension and diabetes, conditions that are manageable, yet remain largely undiagnosed, untreated, and dangerously uncontrolled. The consequences are devastating. Strokes, kidney failure, heart disease, lives cut short, families shattered, a health system under siege. Today, patients see their doctor once every few months for a few minutes. In between, they are on their own. Medication adherence slips, complications silently advance, warning signs go unnoticed. We need a smarter system, one that reaches patients where they are and keeps them connected to care, in between hospital visits every single day. Introducing NkwaPlus, a digital health application purpose-built to transform how hypertension and diabetes is managed. NkwaPlus moves care beyond the walls of the clinic. It creates a continuous, connected relationship between patients and their doctors through a simple, powerful mobile application. Clinical and lifestyle schedules, monitoring and guidance, all integrated into one seamless app for every patient wherever they are. NkwaPlus enables sharing of vital signs from home directly with doctors instantly. When a vital falls out of range, the system alerts doctors in real time. Doctors can consult with you immediately via video conference. Early intervention. Before crisis develops, patients receive personalized reminders, lifestyle guidance, and progress updates, keeping them informed, motivated, and firmly on track. NkwaPlus supports patients and clinicians to achieve outcomes that matter. Stronger medication adherence, earlier identification of complications, reduced hospitalizations and emergency visits. For health systems and insurers, NkwaPlus has the potential to connect more patients, helping reduce the cost of poorly controlled chronic diseases in healthcare. For patients, it means something more fundamental: the confidence of knowing they are never alone in managing their health. NkwaPlus is shifting care from episodic to continuous care, from reactive treatment to proactive management. To the doctor keen on efficient management and control of patients' conditions, and to the patient seeking better results, get in touch and let's reimagine your care journey together. NkwaPlus, care on the go.
All right, thank you so much. So at this moment, we have put an evaluation link in the chat box. Kindly do well to fill it. That's what we'll be using to get the CPD points for our health professionals. So nurses, doctors, pharmacists, please do well to fill the Google form link in the chat box. All right, so we have some questions in our chat box and our Q&A. And for the first two, I think probably addressed to Dr. Thompson. So the person is asking how feasible this app that I believe is NkwaPlus will be needed in places where we have large hospital settings, rural areas, and most of our patients are illiterate. Some people may not actually be using a phone. How feasible is the use of this app compared to probably seeing the patients as we usually do at our OPD in the context of rural settings, if you want to take that. Then the second question is, do you see any limitations to the use of NkwaPlus as a family physician, primary caregiver? Any limitations that we should take note of?
Okay, thank you very much for your questions. So to address the first question where it talks about those who may be illiterate and may not be able to use the app. Previously, when we piloted the previous app that was mentioned, that was the Lucy, there were people who were in that category, not only in the rural setting, but also in the urban setting, who were not able to understand what the app was about. The good thing was that they had a child or a grandchild who was able to navigate the app. And so we educated those people who were their caregivers or lived at home with them, and they were able to help them use the app very smoothly. So that's a way of counteracting that limitation. With the, what do you call it, limitation of the app, what can come to mind is with those who don't have a smartphone. If you have an analog phone or what we usually call a YAN, then you wouldn't be able to use this app. I think Kwesi can help me to probably chip in to answer the second part of the question. Thank you.
All right, okay. So, Dr. Entry, as you come on to help with the second part concerning the limitations of the app, there's also another question that says, does it require internet access to operate? You said it, but maybe you want to reiterate that farm when you come on.
Yes, yeah. So we've designed it such that you can actually, for most of the, so currently NkwaPlus is live on the Google Play Store. So you can actually download NkwaPlus as a patient. That is after you've been onboarded as a patient by a facility. And if your smartphone is an Android smartphone and has a version, if you have a version, Android version 5 or higher, you should be able to download the NkwaPlus application. If you are using iOS, any version 12 or upwards, you should be able to do that. But then what we normally tell patients is that if your phone is able to use WhatsApp, it should be able to download the NkwaPlus platform, because we've designed it such that most of the phones should be able to take that. For feature phones, you wouldn't be able to obviously download the NkwaPlus application. So that's the system we have in place now.
All right. So the next question is, so obviously it means you need internet access to use the app.
Yes, you need internet access. You need internet access to access services on NkwaPlus. But what we are working with the developers on is to also roll out an offline functionality, and that will be an update that will be received in the future. The offline functionality will mean that you can actually share the measurements, but then the measurements will be shared with the facility when you get access to internet at a later time. So that's the offline feature that we are working with the developers on. But currently, you need internet for NkwaPlus to be operational on your phone.
All right. So you say, when is NkwaPlus going to be launched? And what is the qualification and certification an individual or facility must have in order to sign up for NkwaPlus? Maybe if you want to go over the parts, because I think the person missed it in your presentation.
In fact, we are officially launching NkwaPlus here. We are launching it here. So we've actually signed on a number of facilities. We are working on onboarding these facilities, and we are also working on supporting them on board some patients. So if you're a facility or you're independent account interested in using NkwaPlus, you can just reach out to us. We usually have, a number of processes in place to ensure that at least if you're a medical doctor looking to use NkwaPlus, you are taken through the right procedure, and we are sure that indeed you are a registered medical doctor. So we have that system in place to check that. So if you are interested in NkwaPlus, just get in touch with us, and we can just walk you through the process.
Additionally, if you contact anybody in Suffolk, we should be able to also link you as well. So we are getting lots of comments. We are grateful, Doctor. Thank you for the presentation. We are grateful. Excellent presentation. Very appreciative of the opportunity and all that. Like I mentioned, there are evaluation forms in the chat box. Kindly use that to fill it. That's what we use to accredit your CPD points at your various professional bodies.
Dr. Nama, I was also going to add that in the evaluation form, you actually have the opportunity to indicate if you are interested in using NkwaPlus. So if you can fill in your details in the evaluation form, we'll be happy to get in touch with you and pick up the conversations from there.
Right. All right. So the next question, still to you, Dr. Entry, is thank you for your presentation. I would like to know whether the insurance scheme reimburses healthcare facilities based on predetermined fixed fee, or whether the facilities submit the amount they intend to bill for the service, provided to the patients of the insurance company.
Okay, thank you very much for that question. So currently, we don't have a system in place for insurance companies yet. The system we have in place is to support corporate clients. So as you know, there are times when you have patients that are not necessarily sponsored by an insurance company, but are being taken care of by their companies or their employers. So let's say if you have a patient from Stanbic Bank being sponsored by Stanbic Bank, we have a process in place that supports the facility to bill Stanbic Bank for that particular employee. But particularly with health insurance companies, it's a discussion that we are currently having with the National Health Insurance Authority. And that is why the implementation of NkwaPlus is very important, because depending on how it goes, we can actually have something to stand on, to have a discussion with the National Health Insurance Authority and encourage them to implement digital remote monitoring, tariffs for digital remote monitoring at that, so that more facilities are encouraged to take this up as a care model.
All right, okay. So for Dr. Thompson, before I come back to you, it says, can the app be used for other medical specialties?
Oh, yes. The answer is yes. It can be used for other medical specialties. And like we see presented towards the end of his slides, he mentioned that an evaluation that was done, which was quite interesting, showed that even surgeons can make use of this app.
Yeah, good said. So it's really for monitoring patients with chronic conditions, and because of that, it can be used.
To add on to what Dr. Thompson said, so we are actually working to expand the scope of NkwaPlus to include other chronic diseases like the cancers and all that. But we also feel that focusing on hypertension and diabetes for now gives us like a good template to design, other care models for other chronic diseases. So as it stands now, if you're onboarded on NkwaPlus as a patient, you only get the benefit of enjoying, the services around hypertension and diabetes management. But as we go through the implementation, we'll of course be looking at other disease areas that follow the same templates.
All right, thank you. So someone has put it up on the chat box that the evaluation forms does not open. So may I have the technical team recheck that for my participants to make sure that they can fully access this form and fill in to get their points. All right, so from Dr. Kwesi Entry, yes. So the next question is, who pays for the practitioner's data use? If an institution come on board, sign up for NkwaPlus, and now wants prescribers, healthcare team to use it, who is going to pay for their data use? Have you had any situations like that?
I mean, internet data.
Internet data, yes.
Yeah,
complaining about the numerous times we use our call credits to do the calling in the health facilities because obviously there's not intercom or there's no telephone services. So now if practitioners have to use their data, I mean, they are not signed on as individual. Let's say the institution has
Yeah.
signed on
Yeah.
and then they are using their data. Who pays for it? Who do you think pays for that?
That's a very good question, and we actually had these challenges when we implemented this particular care model. I mean, during the time of Lucy and all that, and it's also the reason why we built a business model around NkwaPlus. And as I shared in the presentation, we are going with a model where we are ready to actually sacrifice 80% of whatever revenues that is generated on the platform for the facility. So we are hoping that when a facility is signed on, whatever costs that have to be incurred around data usage and all that can actually be incurred from the 80% that is retained by the facility. So yes, it's a challenge, and indeed it is a challenge that we faced in the past. But that was when we didn't have any business model around digital remote monitoring. But we are of the view that putting together a model that sacrifices 80% of the revenues to the facility should provide them with enough resources to also, support their clinicians who are on this particular remote monitoring care model.
All right. Okay. So the next person says, great presentation. Is there any contact information to discuss further? Please fill the evaluation form. It is in the chat box and indicates whatever that if you need to be gotten back to, then we can reach out to you per the information you provide for that. Then it says, why is it called NkwaPlus?
That's a good question. So I think we went through a whole exercise of scoping for potential names for the application. We wanted a name that could resonate with with Ghanaians and could also carry the meaning or definition of what we are trying to do as an organization. So that is the name that we finally settled on. But I mean, there were other interesting ideas like Apomuding and Amoding and all kinds of names that we came across. But we settled on NkwaPlus because it resonates with a lot of patients, and it also carries the meaning of exactly what we are trying to do with the application. So that's the reason why we settled on NkwaPlus. Yeah.
Okay, so the other part of the question is a bit technical. It says, if a clinician has 20 patients on the app, how does the monitoring look like on the clinician's side? What happens if this clinician is on leave? And who provides data for the clinicians? You see, the data aspect is very important for us clinicians. Yeah. For how it looks like from the app, I guess more, or you can explain too.
Yeah, I can explain that. So the system has been programmed such that when a patient is assigned to a clinician, it is expected that after 1 or 2 hours, the patient should be, after a period, the patient should be processed by the clinician. When that period lapses and nothing has been done on the patient returns to a pool that is accessible to all other clinicians on the platform. So you don't have a situation where after a patient has been assigned to a patient has been assigned to a clinician, the patient is left hanging if the clinician is not around. So we've put together a system around that so that even if someone is not available, that patient still has access to other clinicians for the clinical support needed.
All right. Then the last question I see here says, great presentations. Please, who is legally liable, especially with respect to private accounts? And is that a factor in determining the rate or costs?
Oh, okay. So the rate, the revenue sharing 80-20% model that I explained is actually the same across both account types. So if you are being set up as an individual account, or being set up as an institutional account, we still go with the 80-20% split that I explained earlier on. We don't really change it in any way or format. Pertaining to who is responsible for that data, whatever, we spell it out in the contract, and we usually would explain it to you during the contracting process. But as much as possible, we provide the technology for patients to be connected to the clinicians. But as much as liability is concerned, I think it sits more with the clinician than the enablers of the care model. So that's how we've designed it. But we are hoping
what about data protection?
Yes,
You want to
data
comment
protection.
on that, because we have our patient data now on the digital platform. So how strong is your app in protecting these patients' data?
Yes, very, very strong. We before we sign you on as a facility, we actually have data processing agreements, which spells out, what each partner is responsible for, and what roles we play within, protecting patient data and all that. And we've tried to, as much as possible, also align our processes with the Data Protection Act that we currently have. So yes, it is a very secure platform. One thing that we've also done is that when we're testing the digital remote monitoring model with our partners, Lucy and also COVID Connect, some of the data was actually not localized here in Ghana. But in developing NkwaPlus and working with a local partner, we've transferred all that data to servers here in Ghana. So it makes it even more within our reach in terms of processing and all that. So those are the systems that we put in place.
All right, okay. So that's rounds up all the questions and comments. There are lots of congratulatory, nice presentation, appreciative posts. And we are truly grateful that you enjoyed the session. And please note the Google link is still in the chat box. So if you haven't filled, please do so that we will have your details and be able to credit you with the CPD points. Any last words from our facilitators? I'll first will give the option to Dr. Thompson to give some closing remarks. Then Pham, you come in right after her, then I can give my closing remarks.
This is a great and very strong tool that use in this modern era to be able to reach out to our patients. It's something that we should patronize, and I believe we'll be able to see better results so that we can achieve better morbidity and mortality data for our patients with these non-communicable diseases. We want to work on reducing the numbers. So let's work together as a team and be able to achieve this. Thank you very much for your attention.
Doc, thank you very, very much for offering us your platform to launch NkwaPlus. I want to end by saying that because I want to make it clear that with this presentation and with this program, we've actually launched NkwaPlus. So we are hoping to having discussions with facilities and also individual doctors and even other healthcare workers on how NkwaPlus could work for them. This is a new thing, but not new, like I explained in my presentation. I think as healthcare workers, we'll be more, conversant with telemedicine for some time now, which is great. But I think adding digital remote monitoring to telehealth gives us the opportunity to present a much more comprehensive package for our patients suffering from hypertension and diabetes. So I encourage all healthcare workers to, sign up on NkwaPlus. And I also encourage all healthcare workers to join us as we explore some of the interesting things that we have around digital health. And I spoke about how we could, introduce tariffs for digital remote monitoring and even introduce outcome-based payments for patients with hypertension and diabetes. So first join us with NkwaPlus, and by joining us on the NkwaPlus booth, we can together join hands and figure out how all these things can be implemented to make our healthcare system stronger. Thank you.
All right, thank you so much. So as we bring today's CPD session to a close, I would like to express my sincere appreciation to our two facilitators, Dr. Thompson, Dr. Kwesi Entry, for your insightful and thought-provoking presentation. And to you, all the participants, for your active engagement and valuable contribution. Today's discussion has reminded us that managing chronic diseases extend beyond prescribing medications in our consulting rooms. We want to be able to reach them at their homes, in whatever community, wherever that they find themselves, and we continue to have accessible, continuous care for them through digital innovations like NkwaPlus. Like I mentioned earlier, and the typical example is yesterday's floods, which demonstrated how people cannot get access to hospital in real time. And when you have platforms like this, they help us to reach out to our patients, and they can also reach out to healthcare providers to have their care. I hope today's session has not only increased our knowledge, it has also inspired you to consider lifestyle medication, digital health to be incorporated in your own clinical practice as you sit in the consulting room. The small changes we make go a long way for our patients, and they transform their health care and also improve their quality of life. So, on behalf of the Society of Family Physicians of Ghana, I extend our gratitude to Farm Access for collaborating with us, their country director, Dr. Maxwell Entry. We are truly grateful. Without your support, this knowledge wouldn't have come to our primary caregivers. And we are happy that you partnered with us to make this education session possible. We look forward to future collaborations to strengthen primary health care, not just for our community, but also for Ghana as a whole. So thank you so much for being part of this, and then have a wonderful afternoon.